Hello everyone, and thank you for joining us. We might have a few more people joining along the way. So some of you may have already seen parts of the series, which is going to continue for another 2 weeks. And the way this is going to go is that I'll do a very brief introduction now, and then Scott will have about 25 minutes for the talk, after which we'll have a Q&A that will be moderated by myself. Given how many we are, I think we can just use the raise hand function and then we'll take questions as they come. So Scott is a professor of health management and policy, global public health and political science, a mouthful, at the University of Michigan. And he's also a senior expert advisor on health governance for the European Observatory on Health Systems and Policies. His research broadly focuses on the politics of health policies, and with particular focus, as you'll see from the talk today, on the policies of and the impact of the European Union on these policies. He's published extensely in a lot of journals that you might all be familiar with, such as the Lancet, British Medical Journal, American Journal of Public Health, and many others, as well as publishing an impressive and editing an impressive number of books, the most recent of which, as I pointed earlier, one of them is on the shelf, Coronavirus Politics. And the other one that might be of special interest to the audience today is the Populist Radical Right and Health, which I heard has 2 excellent chapters on Hungary and Poland, among other very excellent chapters as well. So thanks again, Scott, for joining us today. And the floor is yours when you're ready to start.
It's not on my slides, but the Populist Radical Right and Health, where I'm a junior organizing figure, it's led by Michelle Falkenbach, and it has several excellent chapters, and it's forthcoming from Springer in a couple of months. So basically, if I study you, it's probably bad for your immediate future, seems to be my takeaway about the impact of my career on the world. So thank you all for coming. I'm going to try and speed up a little bit, partly because you obviously don't need theoretical tutorials, and partly because I'd much rather have a conversation and find out how I'm wrong. So, but first I want to start with the necessary slide that I didn't do this alone. This has been a great year and some for collaboration. And in particular, all of the work that I'm going to be speaking about was done in particularly close collaboration with these 4 people who are all excellent, and I recommend that you follow them and follow their work. It's an interdisciplinary team, public health, law, multiple countries. And PowerPoint's being weird. There we are. And also it's given rise to some publications. This is partly me boasting, but mostly that we have actually worked this out. So when I make big declarations about the nature of policy or the theory behind it, there's actually some background to it, and it's built on some empirical research. In particular, I'd call your attention to the things in the left column, which are the more synthetic, kind of up-to-the-date policy work. So I initially had an obligatory theoretical slide about neofunctionalism and intergovernmentalism, and I decided that if I can't tolerate it, people at EUI certainly wouldn't be able to tolerate it. So instead, I opted for just this slightly more avant-garde theoretical framing with Jean Monnet, who of course said that Europe is forged in crisis and will be the sum of the solutions adopted for those crises. This is often taken as sort of a sign that every crisis should lead to more European integration. I prefer to take it as an empirical statement that yes, crisis is what shapes European agendas and pushes things up to the point where they actually need decision in a very veto-filled political environment. Are they the right solutions to those crises? That's an entirely different question, but they do accumulate. And one of the better theories of how they accumulate, which I think might have the distinction of being the first theoretically powerful new idea in the generally dull textbook field of European integration studies, was Jones, Kellerman, and Meunier in comparative political studies a couple of years ago, where they essentially synthesized what I would say is the neo-functionalist case that further integration creates pressures on governments to agree formal integration to handle the effects, with the intergovernmentalist case that when you look at the European Union, governments are very clearly in charge and have been, frankly, for a couple of decades. They're in charge in the trivial sense that they negotiate treaties and they approve them, But even outside treaties, I think I'm convinced by the very large amount of work Markashak is particularly good on the extent to which member states get what they want through a mixture of explicit legislation, derogations, and things that just aren't very well enforced, and we know it. And a salient example would be that the European Union's putative commitment to democracy turns out to be something that is contingent on the member state government deciding that it agrees with it. Anyway, the failing forward thesis, which is what Jones, Kellerman, and Minier put forth, synthesizes the neo-functionalism. Member states get into shared crises. With the intergovernmentalism, they then negotiate the lowest common denominator solutions that they possibly can in order to get out of their shared mess. The article was written about responses to the financial and debt crises of 2008 through 2010. But this is the world has graciously furnished us with a very nice opportunity to test the hypothesis again. Well, but before we do that, I skipped the obligatory theory slide, but I think we have to do the obligatory treaty-based slide. These are excerpts from the enormously long and wordy Article 168, which is the only thing under public health in the European treaties. I bolded some words, and to the extent that you're interested in European law, you know what's going on here. This is practically a dictionary of all the ways you write a treaty to disempower the European Union from taking action, right? Shall complement national policies. There's no negotiation. National policies are the core of the policies, and the European Union can help. Shall encourage cooperation. Can't mandate cooperation. If they don't want to cooperate, they've been encouraged. What else can you do? Improve complementarity. You kind of know what that means. It certainly doesn't mean make binding rules. The whole of Article 168 reads like this. It's very explicitly written to prevent EU activity that the member states don't want to see. And there's a sort of interesting historical debate as to whether its appearance in 1992 at the hands of the Dutch, they were the ones who proposed it, actually was an effort to prevent public health activity that had been growing up under more general internal market clauses, that this was actually an effort to supposedly improve European Union public health policy, but actually create a very limited treaty base in order to discourage further health policy work. So there's the takeaway. If you go to the treaties and you look at public health, you don't really find much, except for the possibility that member states can work together and ask the European institutions to facilitate. So that meant that this EU health policy, for most of the time that I've been studying it, had what we called three phases. And the first phase was Article 168. Now, the generally bereft situation of social policy under the Juncker Commission meant that we all looked for other treaty bases that would do something. So Article 9 says that EU should take human health into account in everything. And there's actually 5 other locations that you find health mentions it as an explicit goal: social policy, which mostly means labor law, consumer protection, and environment. All of this added up to a face of explicit policies to improve health, which had produced one whopping dossier, Olga Leblov was studying it, which was a regulation on health technology assessment. And for all that it's fascinating, it's not going to change your world. So that was the state of things up to 2020. A lot of opportunities for the EU to help in a small way, a small budget, a small number of people in the Commission, a lot of networks, each of them with at least one academic writing about the possibility that the network would start to do something that would change actual health policy, and mostly coming out with kind of bad results. The second phase was where the action was. European pharmaceutical licensing, European market regulation on pharmaceuticals, laws on state aids, application of competition, the patient mobility cases that gave us the only real directives in European health law with any bite. All of that, as you would predict from essentially any interpretation of European integration, came out of the treaty bases to do with the creation of markets. They came out of the activity of the European Court of Justice applying non-discrimination rules. To take an example that I've particularly thought about, the patient mobility law came about as the result, initially famously in this field, of 2 citizens of Luxembourg who got mad because they couldn't get orthodontia and eyeglasses in Belgium and Germany, respectively. And they sued, and the case that came to the European Court of Justice was on whether it is discriminating against other countries' business providers if the national social insurance schemes won't reimburse people who paid out of pocket for a non-urgent care. This is an insane place to build health policy, right? The very small number of people who go to another country pay out of pocket for unauthorized non-emergency care and then want to be reimbursed. But it's a great place if you want to use non-discrimination and all that well-established body of EU law to pry open member state health systems, which is exactly what the court spent 20 years trying to do. Anyway, these are huge industries, these are huge policies, and unlike, for example, Article 168, you can use them to pry open national health systems and introduce a European level of regulation. The third phase is the most ambitious. It is fiscal governance to affect health. So you remember on this slide, union action shall respect the responsibilities of member states for the definition of their health policy and the organization and delivery of health services. Fast forward to 2015, and you had the amazing concept that France had to review the numerus clausus for medical school education on the basis of absolutely nonsensical health economics. And in theory, not in any practice I can envision, but in theory, France could have been fined up to 1% of its GDP for violating the Stability and Growth Pact by spending too much on healthcare and thereby endangering the European economy by having tight restrictions on the number of people who would admit to medical school. I can't think of a worse case of respecting the autonomy of member states in the definition of their health policies than theoretically threatening France with a 1% of GDP fine for not opening up medical school admissions. And I have to say this, but I think every health economist who's ever studied the question says that more doctors create more demand for doctors. So it was also pretty stupid as a piece of policy advice. So Europe has this long history, going back to essentially the beginning of monetary coordination, of trying to police member states' budgets. And over again, it fails. And there's this sort of graveyard. It's like outside Budapest, there's a park full of old statues of Lenin. It's kind of the same thing. There's this graveyard in the literature of people writing about whether the broad economic policy goals would have an impact, or even older coordinating mechanisms, or how Lisbon could possibly be made to promote austerity. It's actually a pretty simple cycle. The European Union gets into a crisis. People who think the solution is rules on member state fiscal policies enact tough European rules to try and guide member state fiscal policies and tell them what to do in all public policies so they don't make a debt crisis. For a variety of reasons, gets undermined and ignored. And then comes another crisis. It turns out it didn't work, and people who promote austerity promote a new one. The result, though, is that like the second phase, this is a very theoretically powerful tool to change health systems. So these three phases are very asymmetric, right? One is kind of nice. One is very powerful. And one is ostensibly very powerful, but has a way of decaying into highly ideological uselessness. So we drew a cartoon to pick this up, and this is an observatory cartoon. If you've ever had the pleasure of going to Gastein, you realize where they found the cartoonist. So there's Article 168. It's a gate. It's a solid gate. It is a solid, well-oiled gate with a good latch. You can open it and you can close it as you choose. And member states have the power to open it and enact things under Article 168, and they have the power to close it and keep it closed. There's only one flaw, which is there's no fence. And so all this health policy was getting made. All these things were being done with an impact on health through agricultural policy, the semester, internal market law, competition law, trade law, you name it. And meanwhile, the gates sat pristinely closed, and every so often somebody from godforsaken DG Santé would come around to oil it, I guess. So we commissioned that cartoon in 2019, and we used it in the second edition of our book about how European Union health policy works, published in late 2019. Within 8 months, we had to commission another cartoon, as you might imagine, because things changed. The numbers here are a little bit wrong because we can't be commissioning a new cartoon every time they change something in the debate about the fiscal framework. But essentially, I suppose they unlatched the gate, but basically the member states ran right through it. And that's the story I'm going to tell, which is how you saw a rather dramatic change in the scale, if not necessarily the nature, of European Union health policy amazingly quickly, essentially in the summer of 2020. I didn't expect it. So let's start with a period that had a lot of impact on people and left a bad taste in many people's mouths. And that's early spring 2020, in particular March and April, which is basically a carnival of national egotism. I'm not sure it's that surprising that, given that everybody thought that an absolutely awful plague was coming for them, that you didn't see a lot of sharing and solidarity and generosity. Most places in the world didn't see a lot of voluntary solidarity and sharing and generosity, right? Germany didn't share much with Italy, but if you look at the Italian regions, they didn't share much with each other either, because everybody thought that this wave of mortality was coming for them, and they didn't plan to give up the masks that they would need in 2 weeks. This meant that even rescue, the little brand new civil protection mechanism where the European Union and the member states co-finance key supplies, wasn't activated. There wasn't much of relevance in the warehouses because it had only been running for 6 months, but what there was in the warehouses stayed in the warehouses. And instead, think back to that crazy 2020 when everybody was sort of trying to procure pallets of PPE and all these fraudsters were doing creepy things and so forth. Now, there were a lot of bad stories, right? There were stories about Germany not giving things to Italy. There were stories about the Czech Republic seizing a shipment of masks bound for Italy. A lot of them didn't turn out to be accurate stories, right? When the Czechs seized the masks, it turned out that they were actually fake masks, and whoever was shipping them was ripping off the Italian government. But the damage was done. And the Chinese, with their customary skill, flew a few elaborately choreographed plane loads of PPE to Italy right in the middle of worse things, producing headlines like the one you see on the right. There was lots of that, right? And all the people who respond to absolutely anything, including humidity, by saying that it's going to cause the breakup of the European Union, said it was going to cause the breakup of the European Union. That wasn't what happened, because member state governments fairly quickly learned something. The first thing was that national egotism in supplies was really self-defeating, because nobody had built supply chains in Europe for decades with the expectation of autarky, which you would expect from looking at all the problems with trying to disaggregate supply chains in and out of the UK in the aftermath of Brexit, right? So Italy happened to have the main mask factory. Would anybody have been in favor of Italy having a monopoly on masks when the pandemic hit France and Spain? Lots of other cases of this. A lot of the raw materials for vaccines today come through producers in the United Kingdom, giving the UK a stranglehold on most of the vaccine production in the EU. That's turning out to be a big problem, but it's iterated across Europe. There are very few products in the European Union that haven't been to Belgium, but there's very few products in Belgium that are only Belgian. Maybe some of the Trappist beers. So what this means is that because these supply chains are so integrated across borders, national egotism rapidly turns into an incredible series of policy failures, and they figured that out quickly. They also had something looming, which is in April 2020, Europeans' thoughts turned to sun. And honestly, I wouldn't stand between Germans and Mallorca if I could help it. And frankly, I wouldn't stand between Mallorca and German tourism if I could help it either, because this is 10, 15% of the economy. Europe has some of the world's superpowers of tourism. And a number of European countries, notably Spain, Italy, Portugal, Greece, they don't really have the human capital to do other things. So you're making a very high stakes decision if you're Spain or Italy and you're imposing a lockdown in summer. You desperately want to get it out of the way so the summer party can restart. Now, it's easy to overstate workforce mobility in Europe because academics run around Europe all the time, but there are other key sectors of more immediate consequence to keeping people fed and healthy. There's a huge amount of workforce mobility in healthcare, particularly in qualitatively lower skilled areas like long-term care, nursing homes, hospital cleaning, all the things we've discovered are really important, and agriculture. There's a very large seasonal movement from east to west across Northern Europe every year, because who's supposed to harvest the crops? And it's a seasonal movement because they go home because there's nothing to harvest in Germany or the Netherlands or Denmark in January. Southern Europe, you have year-round mobility, which means that you keep recycling viral spread around all different parts of the economy as the agricultural workers move north and south across Spain. You get very big continent-wide east-west labor mobility, which turned into epidemiological mobility for the virus. All of this amounted to member states learning quickly, and by that I mean by May of 2020, that they were no more capable of shutting themselves in their apartments for the next year than their populations were. So we have a nice functionalist case. And there's your heroes riding to the rescue in the service of functionalism, titanic figures of European politics, here to lead. Well, what they went to work on was the first phase. This is endlessly fascinating if you like reading European Union websites, but I'll rattle through it quickly if you're not an EU health nerd. So there had been a health program. It wasn't a great program, but it fulfilled the key European function of paying people to talk in a European way about European things. And it was ending. It was being folded into the structural funds because its contribution to economic growth in the eyes of people like Jean-Claude Juncker was limited. Well, instead of killing the health program, they massively revived it with the EU for Health program. The Commission initially asked for an insane amount of money, 26 times more budget than it had had previously, and got bargained down to 9 times more budget, which a lot of people who like health programs were very sad. And I thought, frankly, having my budget increase 9 times over in 1 year would satisfy me for the short term. Vaccine strategy, we'll get back to that. But basically, they opted to have collective procurement, not just joint procurement. Joint procurement is when you band together and negotiate a price and buy separately. Collective procurement is when you buy as one gigantic customer. And they delegated responsibility for doing that to the EU institutions, notably the Commission. At the same time, they created a pharmaceutical strategy because they had realized that there was not only was there shortages of therapeutics, not only were they concerned about vaccine discovery and supply chain, they also realized that they didn't really understand their supply chains, and they didn't know until they asked the experts, for example, how dependent they were on India. We're all learning a lot about dependence on India right now. And in a sense, the pharmaceutical strategy's goal, the first thing that's being done by people who created it, it's not doing it, is precisely to try and onshore European vaccines production so you're not vulnerable to Indian policy decisions. Then agencies. There's a European Centers for Disease Control and Prevention in Sweden. It's a little capacity building agency with a fairly decent data collection function. It's going to get a bunch of new resources and authority to do things. And they want to create a new hero research agency against pandemics. Everyone in the world is talking about this. BARDA is the American model, the Biological Advanced Research and Development Agency. Every unit of the UN seems to be trying to create an anti-pandemic agency and maybe an anti-pandemic treaty to boot. In Europe, it's going to get called HERA. It's probably going to happen. And its focus is going to be on things like supply chain resiliency, general health systems resiliency, and development of new technologies, kind of paying for innovative things that weren't being done otherwise. It's a little bit hazy still. Finally, civil protection and rescue. Civil protection grew out of previously what had been a cute European kind of international assistance system for rounding up earthquake response teams when there was a disaster somewhere else in the world and sending them. It was basically foreign policy. They started to use it quite naturally when they discovered that the Spanish had firefighting equipment and the Swedes had wildfires. It had just been turned into rescue, which I talked about, but they've expanded it a lot. They've both put a lot more money into it, and they've made it easier to co-finance so that you can say, I want to have a PPE stash and I, as a member state, want to pay for half of it. You can go straight to the Commission and buy yourself a huge new stash of PPE or fire trucks or whatever. And then they're in your country, but they're usable across the EU in the case of the activation of rescue. So they've done a lot. It's all within, with the semi-exception of HERA, it's all within structures that the European Union has known has been operating well, right? It's not a structural change. It's a gigantic change in money and what's being asked. Not quite so exciting in the other phases. There was the weird period of national egotism. The Commission acted quickly. I think they were kicking in an open door because I think member state governments were realizing that if you cut off Belgium from supplies, Belgium can cut you off from everything. Very weird to think about Belgium as a superpower. There was a legal change that was quite interesting. EU law, but going back to 1956, had defined public health as an exception to general rules. So there's a general rule of market integration. Public health was an exception along with morality and public safety. So a member state could invoke public health in one sense. They could invoke public health to say our public health is undermined by your market integration, therefore we don't have to obey your market integrating rule. This was actually the Cassis de Dijon decision, was about the scale of the public health exception, because the Germans said that Cassis de Dijon had the wrong alcohol level and Germans would get confused and become drunk. And the Court of Justice said that was not an appropriate use of the public health exception to a law that would normally allow the French to export Cassis de Dijon if they wanted to. In spring 2020, the Commission put out a legal opinion redefining it that public health is a European thing. So member states can invoke a public health exception if it helps European public health, not their own public health. Lawyers got really excited, right? That's a major change in the definition of public health, and it would essentially change what the public health provisions in the treaty function to do. Will it stick? Commission legal opinions are powerful, but they are legal opinions. They're not more than that. There were efforts to coordinate travel rules. They're pretty effective, although I could go get on an airplane and fly to Greece in about 3 hours with very little preamble. And they also backed off application a lot of everybody's favorite European Union rules. There was an enormously stringent regulation of medical devices that was about to take effect. They delayed it. State aids, if you're an airline and you ask for a whole ton of money, you can have it. As far as I can tell, they've renationalized Air France and nobody's noticed. So a lot of our favorite EU regulations, they stopped applying them pretty explicitly. In a sense, that was also what happened over in the third phase of fiscal governance. They immediately invoked the general escape clause. The semester process is effectively suspended. And instead, there's the light conditionality of the Recovery and Resilience Fund, which is pretty much, no questions asked, large amounts of direct support to member state budgets, which had been exactly the thing that nobody wanted to do for the last decade of debt crisis. And there's kind of a cute argument among people who know political economy better than I do as to whether this is the Hamiltonian moment when the EU becomes more of a real federation. I will shy away from that because I honestly don't know how you would empirically develop and test that argument, except by waiting a decade. So I promised vaccines. I'll do vaccines quickly because that's what we're all mad about. The vaccine strategy is what it says on the tin. It's a big solidarity thing, right? If originally kind of 6 really big member states with big markets who knew how to deal with pharmaceutical companies were going to go in together, and they decided to instead to negotiate for all 440 million EU citizens. This has the advantage that if you represent 440 million people who are by global standards quite rich, you're going to be able to get the attention of pharmaceutical companies, whereas Malta, Estonia, Cyprus might take a while before they get a meeting with an executive at Pfizer. Secondly, it is solidaristic, right? So you can negotiate better from the point of view of Germany because Germany doesn't have 440 million people. You can also negotiate better from the point of view of Cyprus because you can negotiate it all. The member states could always go outside them. Some of them have now because there is, as we know, some dissatisfaction. Now, the EU institutions focused on price and liability. That's not what everybody else did. The UK and the US in particular are paying significantly more per vaccine. And when it looks like they're not, it's because they put a lot of money into the development of the vaccine for the company. The EU didn't particularly support vaccine production initially, and it focused on negotiating a good price with 444 million consumers. They also focused on making companies take liability. I think this runs contrary to pretty much everything we say about normal good policy and vaccine regulation, because a vaccine is a public good and states should underwrite public goods. But they did anyway. And my theory is that they guessed that the anti-vaccine people would have an absolute field day if it turned out that they had used public money to indemnify companies against vaccines should the vaccines go wrong. 2 things then happened starting in January when it turned out that the British basically had a vaccine truck coming down the street firing needles into people out the window while nobody in Europe could get anything. So lots of blame to go around. One is you blame the European Union for problems. I think this is a basic rule of politics. Brussels exists to be blamed for problems. If you don't like being blamed for member state fuck-ups, then you shouldn't work in the European Commission. The European Union is also, however, not blameless, right? They negotiated slowly. They asked EU lawyers instead of contract lawyers to draft the contracts. They treated it to some extent as an industrial policy, which is why half the continent's mad at France for forcing Sanofi to have more of a chance than it deserved. et cetera, right? The EU is not blameless. The individual European institutions on their own are not blameless. The Commission could have hired a law firm to negotiate a better contract with AstraZeneca. Anyway, everybody spent the first half of the year in a very bad mood on the subject of vaccines, right? A vial in a freezer. Vaccination is different. Vaccination is putting it into an arm. The short version is that that's got almost nothing to do with the EU. Once the vaccines arrive at the airport, they're the member states' problem. This is going to produce a lot of diversity. In particular, vaccine hesitancy in Central and Eastern Europe, basically anywhere the Red Army's ever been, is extraordinarily high, like staggeringly high. And it's pretty consistently around 60 to 70% of people either say they will not take the vaccine or they will need good persuasion. And you've seen it in countries that are not entirely distant to the European Union, like Serbia, where Serbia is full of vaccines and they hit a ceiling of a very low part of their population almost immediately of people saying, I don't want the vaccine. So you're going to have an integrated market full of people moving around, including people moving across neighborhood borders, where a bunch of them are going to have very, very low vaccine acceptance rates. And lest you think I'm picking on Central and Eastern Europe, France is often an absolute champion for not taking vaccines. So no matter how good the Spanish, the French, the Germans, and Belgians are, they're next door to France, and that's going to be a potential headache. So the next step in awkward European political issues could well be ongoing outbreaks in a half dozen to a dozen member states, including France and much of Central and Eastern Europe, creating problems for more vaccinated but not completely vaccinated countries that they're closely tied to, right? Germany's sitting in between the two of them. Good luck. So that was the promised vaccine slide. Now, kind of a methods word. That's Tolstoy. Tolstoy famously said that all happy families are alike, but every unhappy family is unhappy in its own way. That's the story of COVID-19 so far. Because what he's saying is that to be a happy family, you have to do so many things in a certain way that you don't really have a lot of ability to be creative. And in managing COVID-19, particularly in 2020, most member states, most countries in the world knew what they needed to do by April. Most of them failed to do it. And you can pick out the different interesting stories, how the Czechs screwed it up, how the Americans screwed it up, the amazing story of how the Swedes screwed it up, or the tragic story of how the Italians screwed it up, but they screwed it up. And that means that's probably a better way to think about how about countries. Instead of doing what we instinctively do, which is to pick a dependent variable and say, my social democratic corporatism is better than your liberal corporatism, or my social democratic welfare state is better than your conservative welfare state, which is how we instinctively set up dependent variables in comparative politics. The analytic challenge is to evaluate on something else, because as political scientists, we frankly don't know what creates mortality. Epidemiology is hard, right? There's population level variations in the structure of immune systems that have nothing at all to do with history or political science as we know it. Demographics, right? Djibouti seems to have a lot of COVID-19. Djibouti's population is 1/3 under 18. Very different effects. I could go on, right? Household structure. Italians socialize with their parents more than the Swedes. And furthermore, it's so easy to overstate the impact of policy, right? We can constantly compare policy stringency, which you can graph thanks to the Blavatnik school, with mobility, which you can graph thanks to Google. And there's a lot of countries where they don't really have much to do with each other, where it turns out that if you close the workplaces, they all go to each other's house and have parties together. Human enough. So be careful about evaluating, right? It's very tempting to talk about how this country was worse than that country. And at any given time, you can feel like you say it because one country's got a surge and one country doesn't. Be very careful. Now, if you define European activity from an integration perspective, it's had a good pandemic. The EU role expanded at the behest of member states. They wanted it. They kept control of the process, and what they turned out they wanted from the process was quite a lot more Europe. Quite a lot more first face relative to the other faces. If you want a health, social European Union, this is a step towards it. This is a real step towards it. Jacques Delors would be pleased. It's path dependent in form. There's not a lot of institutional creativity. How much institutional creativity do you expect in 6 weeks in the middle of a pandemic over Zoom? But big changes in budgets and goals. The vaccine strategy is high risk because it's not so much that they're going to undo these institutional forms as that they lose legitimacy, they lose budget. It gets recorded as a big failure and nobody wants to have any more of such European activities. Remains to be seen. That's the risk to the EU. There's also, of course, risk about, so for example, the European Health Union, which I doubt is going to happen, but it's basically a proposal for a treaty change because a certain kind of person doesn't think that it's a European policy unless you have your own, subsection of the treaty. And finally, I have to point out that the ongoing process of authoritarian consolidation is going great. COVID-19 was a brilliant opportunity for countries inside as well as outside the European Union to have their local authoritarians try to stage various forms of crackdown and coup. I speak to you from the United States, where it just barely didn't work out, but the rule of law and democracy in the European Union didn't get better in the course of this pandemic at all. So thanks.